Welcome back to It's Your Case, presented by VetCT.com. This is Heather. This week's example is a 12-year-old female spayed cat who has progressively been deteriorating in the owner's impression over the last 12 months and has had sudden onset of dyspnoea. Once you have reviewed the radiographs and you're ready to watch this video. So, I'll highlight the most important findings in this case. We've been looking at heart size over the last couple weeks, and I said we could discuss lung patterns today. So I think, although there's definitely something to talk about here, cranial to the heart, I thought this was a great example of a lung pattern, and I want to start there today. Here I've zoomed in to the caudodorsal lung field in this case. What I want to show you is that when I'm trying to determine what lung pattern is present, one of the things that I can look for is the presence of what we often refer to as lines and rings. This is examples of lines and rings in this case. Lines and rings have to be present on all kinds of digital images just because of the quality of the images. So when is a line and ring a bronchial pattern, and when is it just maybe the normal appearance of the pulmonary tissue? Well, one thing that I like to look for is that not only that the rings are visible, but that they're thick. So the wall of a normal bronchus should not be this thick. So we're not just looking for lines and rings or donuts and railroad tracks, but we're looking for the thickness. Here's another example here where the walls are thick. Next thing that I think it's nice to consider is how numerous they are. In this case, I can see them all over the place. Here's an example here, probably another example here. Here's one here, a great example here. In terms of a third criteria that I really like to kind of tick the box when I'm diagnosing a bronchial lung pattern, I would say I'd like them to be, when possible, located fairly peripherally, okay? The reason I say that is, again, with a digital image on a really nice radiograph, sometimes you're going to see some of the larger bronchi, but that's going to be manifest closer to the hilus of the lung. So for a bronchial lung pattern, and let's go to her caudodorsal lung field on the full image, we're looking for lines and rings. We want them to be numerous, and we see many in this case. We want them to be located peripherally, and we want the walls to be fairly thick. You may notice that I keep saying lines and rings or donuts and railroad tracks, but I'm mostly pointing out rings, and I haven't really pointed out any lines. I'm going to show you here one example. I'm going to try to put arrows on both sides of the railroad track. Here's an example of a little railroad track. The reality is that when we're radiographing, we just seem much more likely to catch end-on bronchi, creating rings or donuts, than we are to catch them in this kind of longitudinal plane, creating the railroad tracks. So don't be too put off if you see lots of rings and only a few lines. Now, when you looked at this radiograph, many of you talked about what is this in the cranial mediastinal area. One term that I heard several people mention that I was really happy to see is the term border effacement. I'm just going to take our lines and ring arrows away to talk about the cranial mediastinum a bit more. So border effacement is the term that we talked about whereby we're not able to see the edge of a structure because it's in contact with another structure that has the same opacity, and so therefore the borders are obscured. Another term that we use for this is silhouetting. This is definitely what's happening here with the cranial border of the heart. Although there are a lot of different structures that can be in this location, we need to use both views as well as, I won't deny, a little bit of a radiographic leap of faith to decide where this opacity is coming from. So in my opinion, when I look at the VD view, and I'm going to acknowledge that this is not the best radiographic quality, we definitely have some motion artifact here, which for anyone who's ever radiographed a dyspneic cat, you can probably appreciate that it's not always easy. I will point out this is actually a pretty good example of some railroad tracks or lines right here running through here. But getting back, we'll just leave the bronchial pattern for a sec and get back to this. So when the entire cranial mediastinum in cranial sort of thoracic space is obscured by soft tissue, I often think about whether this could be a mediastinal lesion. If it were a lesion in the lung, generally it would be in one lung lobe or the other, and we would expect that on the VD view, we would see some lung tissue extending cranially. And in this case, I just don't see that. Of course, the trachea is displaced dorsally in this case, and although that can be a sign of cardiac enlargement, and I don't think we see enough of the heart here to really exclude cardiac enlargement in this case, remember that craniomediastinal mass effect could also push that trachea up. Now, when I see this much soft tissue opacity, When I look at the VD view and I don't think it's in the lung, therefore I think it's in the craniomediastinum, for me in a cat, thymus goes way up the list as the most likely origin of this tissue. Thymic epithelial tumor, given the age of the patient, is something that I would think about pretty seriously. So, where have we landed with this case? I think if we were going to put everything together, we would probably struggle. But a great example of a bronchial lung pattern, we didn't talk about differentials for that yet. My general differential for a bronchial lung pattern in a cat is to prioritize feline asthma, which is often the most likely thing. However, other causes can actually include neoplasia, in particular lymphoma or carcinoma, which is thought to manifest because of peribronchial lymphatics, which can spread neoplasia. Lastly, in cats, heart failure has actually been described to potentially present as a bronchial pattern. So in this kiddo, I would have to have all those things on my list for sure. While we were talking about the cauda lung field, I didn't mention that there's also this gas-filled structure back there. Of course, when I find something unusual on one view, I always love to go to the other view, and here we have motion and a little bit of obliquity, and it's actually kind of hard to see where that is. I think this is probably representing a hernia, like a hiatal hernia, but I'm not 100% sure. So, putting it all together, we suspect a large craniomediastinal mass effect. I would be quite certain that there's also some pleural fluid here that's contributing to this border effacement. You could correlate that with a TFAS to confirm pleural fluid and enable sampling. You could also correlate with palpation to sort of see the chest compliance in the craniomediastinum, and often we can do intercostal sampling of the thymic mass if it's considered safe. The bronchial lung pattern may be related or may be entirely unrelated. So, thanks for listening, and be sure to review the full report associated with this case. Join us next week as we continue with our examples of lung patterns. And remember, it's your case, so post your questions on social media.